Okay, I'm going to use belt, or you could use a strap, anything. It's convenient that we have to have jiu-jitsu belts. So I'm going to do one leg at a time, but the other leg is going to act as a post. I'm going to wrap this around, and what I want to do, I'm going to start off by finding how far out to the side I can go without any sketchy feelings at all. Like no grinding, no, we're going to go on strong here. Okay, so even if that's like out here, that's totally fine. All right, we're going to still work on our PAILS contraction, our progressive angular isometric load. It's going to build into our regressive angular isometric load for internal rotation. So I'm going to find, all right, here is my spot, and then I'm going to maybe back off just a little bit because I'm probably not going to tie that exactly right here. All right, get nice tight knot. Okay, test it out. Okay. Do I still feel strong there? Might need to adjust a little bit. Get a little tighter because of the little bit of stretch that you're gonna have from the cotton. Okay, so what I'm gonna do, I'm going to take this and I'm going to keep it strong. I'm going to irradiate the crap out of my body. Maybe you did some irradiation homework to start off as your warm-up. I'm going to squeeze into the ground. Maybe you have something here. Maybe you're holding on tight. You could be leaning against the wall. If you feel any strain in your back, use the wall for support because our focus is for the hips right now. This is going to stay still, and I'm going to open with this one. We're going to do a 20-second ramp. Out in, you're going to hold for 10 seconds trying to go as hard as you can, and then you're going to slowly relax over the course of 5 to 10 seconds too. We'll see how if you want to get there, okay? So first thing is making everything rigid. Deep breath. Pack some air into my belly like I'm about to get punched in the gut. I'm going to squeeze into the ground. I'm going to squeeze my shoulders. Find my abs, find my ribs. Press into the floor strong with my other foot, with my base foot, and I'm going to slowly, I'm not engaging too much yet on this hip. I'm going to, as slowly as possible, imagining I'm moving one cell at a time, start to ramp out. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Check back in with your shoulders and everything. 12, 13, 14, 15, 16, 17, 18, 19, 20, hold for 10. You're trying to max out more. If you have anything left, keep going. 7, 6, 5, 4, 3, 2, 1. Slow it down. 10, 9, 8. Gradually releasing. 7, 6, 5, 4, 3, 2, 1. Good. Okay, now you're totally relaxed. You haven't moved anything, okay? If you felt comfortable there, keep it. If you feel like you need to adjust because something didn't feel good, or you can maybe find more irradiation. I'm going to try sitting up this time. Also, I'm going to put a thing in the front of this and make sure that you stretched for 2 minutes first, okay? Round 2, same thing. I'm going to squeeze tight. Maybe I have something in my hands for tactile feedback. Maybe I'm squeezing something under my armpits. I'm going to bring my shoulders involved, whatever I can find the most engagement through the rest of my body. I'm squeezing on tight, holding my ribs. Belly is tight. Whole body is turning to stone. Pressing hard into the ground with this foot gripping strong. Ready? And I'm going to slowly press out one cell at a time, trying to get my motion from the outer part of the hip. Ready? So I've got the hip capsule reaching back as far as I can. My butt is reaching back. I've got a little bit of a pelvic tilt forward, as long as that feels okay to you, okay? If it doesn't, adjust to what you need to get some motion through this hip. And beginning to press out as lightly as you can for the first number 1. Tiny bit more 2, tiny bit more 3, increasing 4, 5, 6, 7. This leg stays strong. 8, 9, steadily increasing. Make a better ramp. 13, 14, 15, 16, 17, 18, 19, 20. Hold for 10. 9, you're at your 100. 7, 6, keep going. 5, 4, 3, 2, 1. Releasing for 10. 9, 8, 7, 6, 5, 4, 3, 2, 1. And you are getting some work on this other hip too, but it's in a range that's totally safe. Again, if you feel any pain in any joint anywhere, adjust your position to find it. If you feel like you've got pain in something and you can't find a way to get around it, address that first. Do some PAILS and stuff, okay? One more. I'm going to try another version just to give you another option. I'm going to squeeze and hug onto this leg, the one that's staying still. I'm going to hug onto it really tight. That's going to be part of my irradiation. Ready? Abs. Let that ride out through your shoulders. Let that ride out through your back. hugging on to my leg strong. My calf is engaged on this side. And I'm going to barely begin pressing out for 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Hold for 10, 9, 8, 7, 6, 5, 4, 3, hard as you can, 2, 1, and releasing 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and out. Easy breath. Twice as long inhales, exhale. I know my radiation wasn't as hard as it could have been. I think, Adam, that you're actually better at a radiation than I am right now. But I'm working on it, okay? So after you've done your set there, we're going to go into our rails contraction. So we've done our PAILS for external rotation. We're going here, which is bringing the knee out as opposed to that. So we're going a little abduction too. Then you're going into our setup that we used. You have a pillow under your hip so that you're more comfortable. You don't have any compensations here. I'm going to pull this knee up as high as I can without pain. I'm going to squeeze the crap out of life. I'm going to engage my abs. I'm going to squeeze my butt here, and we're going to ask for really strict movement here. It's really easy to get a little hip, and you can see in the pattern here that my waist got a little shorter. I'm going to keep this down. So if you want to use your hand to monitor or something, I'm going to squeeze everything as tight as I can first, get maximum radiation. I could have something squeezed in the ball and the bend of my knee, like a towel, or pulling that hamstring in really strong and tight. I'm going to hold on to the rest of my body, not let anything else move. My pelvis stays in one place, so I keep my tailbone tucked as much as I can as I lift that heel off of the ground. You should be in a range of motion that it feels like a fight to do so, and you can't get that far off of the ground, okay? So I'm squeezing everything, and we're going to hold for 10 seconds. So everything is strong. You're going to imagine that you're lifting off of the ground. Imagine, keep everything totally still. The only thing allowed to move is from the thigh down. Keep that butt squeezed. Keep those abs squeezed. Start to get light. Imagine that you're kind of stuck to the floor with that toe, but you're engaging as if you were going to lift off. And when you feel like you've got it nice and strict, go ahead and lift off for 10, 9, 8, fighting for more, 7, 6, 5, 4, 3, 2, 1, and down with control. And do at least 3. If you feel good, you can do more. I'm going to try to keep irradiated the whole time. If you need to relax in between, you can. Ready? Squeeze and go. Get ready. Prepare to lift. Imagine you're lifting. Do everything except lift. Engaging and up. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Down with control. We're going to do one more. Keep that squeeze. Everything's on tight. And engage to lift. So you're firing all that stuff without actually moving yet. And go ahead, keep that butt squeezed as you go. 10, 9, fight for more the whole time. 6, without rotating the pelvis. 4, 3, 2, 1, and then down with control. Breathe and relax here. Okay. And yeah, and do the other side.